I remember I said to Nikki, wow, I had no idea endometriosis was such an all encompassing disease. I learned about it in this little a paragraph like this. Some
Mhm.
women get this disease called endometriosis where scar tissue develops. Da, 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 da. I literally was given a book by Nikki and I read it in a week and my brain was just, what is going, why weren't we taught this? It's all
Mhm.
going on in the pelvis. It's the nerves of the lumbar spine. It's the nerves of the sacrum affecting these organs. Like, shouldn't we know about that?
What's up, ladies? Welcome to the health class she deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I'm your host, Autumn Payon, and today we have episode number 4 in our endometriosis series with Elysara. If you missed the first few installments, go check them out for a deeper dive into endometriosis, and I will link them in the show notes so you guys can find them nice and easy. In today's class, we are welcoming chiropractor Dr. Katie Pacinelli. Dr. Katie has been a board-certified New York doctor of chiropractic since 2005. Having operated her own chiropractic practice on Long Island, she brings her experience and healing skills to Elysara's mission, treating patients that realize the advantages of chiropractic medicine while collaborating with all other medical specialists to achieve their health goals. Dr. Katie, welcome to class.
Thank you. Hi, how are you?
I'm good. I'm so glad to have you here. I'm really excited. This whole series has just been incredible. So I'm really excited to continue adding to it because, as we know, I mean, endometriosis is so misunderstood and yeah, it's just and there's so many different like facets to it, and so it's really cool hitting it from all of these different angles. But
Yes.
yeah, before we dive into all that, how'd you end up at Elysara working with endometriosis patients?
So it's an interesting question. I actually met Nikki, who runs Elysara, through one of the moms at school, at my son's school, who's good friends with her. And I was just telling her about what I do or what I did. I wasn't practicing for a while. And she said, you really should meet my friend. You guys seem to have similar interests and similar things that you really have as goals. And so it was sort of like an itch I had to scratch for a few months. It was like, I should meet this woman. I should meet this woman. And so I finally went in. And just right off the bat, we hit it off. Her vision for what she's doing, her whole practice, the way she's integrating so many different things in order to just go along with this mission of helping these women it was just amazing to me. It just spoke to me. And although chiropractic wasn't necessarily something that aligned with endometriosis and the treatments, I realized that there's definitely a way that I could help these women, I thought. So we kind of just hit it off and
Mhm. The
went from
rest is
there.
history, yeah.
Yeah.
That's awesome, and, it really I mean, for everybody listening to the first episode in this series was with Nicoletta, and so you guys can go listen to that, and you'll hear her passion behind it.
Yeah. She
It's
is so passionate.
yeah,
She really.
absolutely. So, like we said, you're a chiropractor. Let's talk about what chiropractic is, I guess, more generally, and then specifically how you practice because it's a little different, right?
Yes. So chiropractic, means a lot of different things to a lot of different people. People have stigmas in their head of what a chiropractor is, good or bad. There are so many different ways of practicing chiropractic, but really, we are educated in anatomy and physiology and treating the musculoskeletal system, the nervous system, and everything really is connected. So whether you're a traditional chiropractor who does just straight manipulations, or whether for me, I've found with my patients really integrating muscles, fascia, connective tissue, all of that. I found that I got better results with my patients practicing that way. So, what is chiropractic is a very broad question. The term chiro means hand. It's to practice with your hands. And so for me, that's how I always go back to think of it. I'm helping people with my hands and with my knowledge of their bodies. So, in a general way, that's how I see it.
Mhm. Yeah, that's amazing, and, when you're working at Elysara, like, with endometriosis patients, like you said, you incorporate a few different things, because you
Mhm.
find you get better results. With endometriosis patients specifically, let's start, like, are you doing, pre-op, post-op, both?
Both. I can
Okay.
treat patients who have been recently diagnosed who are just
Mhm,
experiencing pain because of perhaps many years of having symptoms and not being diagnosed. And then post op, patients who have scar tissue, patients who have oftentimes when people who are operated on, the doctors see them and they do a great job and then they're kind of on their way and they have to heal. So what do you do then? Now we have trauma to the tissue, we have scar tissue building up, we have altered posture, we have guarding, all of those things. So that's where I try to come in. Again, pre and post, there's a lot of muscle guarding happening, postural shifts that happen, and our whole musculoskeletal system is affected in that way.
Mhm.
And also, that it begins to affect, I find, women, emotionally and psychologically, and now they're starting to feel like they can't do as much, and they're not happy about that, of course. So I try to make them realize that I never say never. I never tell someone to stop working out. I never tell someone to not move their body. My goal is to get them moving, get them living their life and living in a way that works for them. And then over time, treating
Mhm.
their symptoms and getting them to hopefully not have as many after, so pre and post, yes, to answer your question,
Okay.
both, whatever's going
Yeah.
on. Yeah.
So you mentioned muscle guarding. Can we dive into that a little bit more, like
Right.
what exactly muscle guarding is and how it shows up in endometriosis patients?
So, what I'm seeing with a lot of endometriosis patients, and this is really my first foray into treating women with endometriosis because I had just a general practice before. But what I'm seeing with the women who I am treating is sort of a subconscious protective posture, meaning there's anterior pelvic tilt, they'll close inward, all of the pelvic organs that have been traumatized or causing them pain, they sort of fold inward because we don't realize, but we want to protect everything underneath. So now all of the muscles, and specifically I'm finding with the hip flexor, the psoas, it's a muscle that starts in your lumbar spine or your low back, and it goes all the way down, and then it kind of pierces down and inserts below the pelvis. And all of the muscles, all of the organs of the pelvis kind of sit in front of that. And so this specific muscle, I'm finding a lot of trauma, a lot of scar tissue, a lot of adhesion. So I look there first because I'm seeing a lot of that. And there, 9 times out of 10, there's trigger points, which are basically toxic buildup of or buildup of toxins in the muscles, if you will. And they feel like hard and they just feel different under the skin. And I try to strip out those adhesions. I stretch the muscle. I teach patients how to stretch on their own so that we can open up that muscle. And as you open up that hip flexor, suddenly your whole pelvis opens, your posture opens, and you feel like you can stand better. And it's hard over time. It took time to get there, so it takes time to get out of that. But with that, then the shoulders start going, the upper body starts going, and then before you know it, you're looking at someone who's not standing erect anymore, and they're everything is guarding, and our body's way of protecting the underlying organs, the nervous system, everything inside of us is to sort of round up everything around. So, like, we look at our muscles as the things that hold us up, but they're also the things that protect us. They protect what's going on underneath. So the body doesn't know what trauma is going on. It just knows protect the vital organs, protect the nervous system.
So it's like this protective posture that we go
Yes,
into, but
absolutely.
is it like ultimately is it negatively affecting the internal organs, like having that posture all the time, or
I don't think it's directly negatively affecting it, but yes, it is because now the organs can't sit the way they want to. They can't function the way they want to. So now things are getting closed and sort of tighter inside the way they are on the outside, right? So if that makes sense, the organs, instead of everything flowing freely, the nerve flow, the blood supply, the lymph, everything kind of working in the way it's supposed to, now everything kind of tightens up. So now we're
Mhm.
starting to feel like a little toxic, a little lethargic, a little moody, all of those things because we're like, what's going on? My GI function is off. Now I'm bloated. Now I'm not, my bowels aren't working the way they're supposed to. So is it a direct, like the muscles get tight and I get constipated? Not necessarily, but secondarily, yes, for sure. Because when things start shutting down, closing down, even if it's to protect, because fight or flight is, right, the initial
Right.
reaction is to tighten up. So our parasympathetics now aren't working the way they should because everything else is firing. So
Mhm.
our digestive system is affected, all of that.
Yeah, right, like it's all connected, and I've been doing a deep dive into like the neuroscience of endometriosis,
Yeah.
and it's really crazy, and I mean, the more you learn, I feel like it all comes back to the same idea of like you can't separate any of
Right,
it.
exactly. And that's the thing that I'm finding too. And going back to how I ended up here, although I wasn't focused on endometriosis before, it is all connected. So the nervous system is really, I mean, in my opinion, it is the everything of your body. Once that gets affected, everything else gets affected. And of course, the endometriosis is being affected by the nervous system, and then the nervous system is being affected by the endometriosis because we're shifting all of what we're doing to supply what's needed, right?
Mhm. Mhm.
So all of the nerves that supply the uterus, the fallopian tubes, the ovaries come out of our lower back, our lumbar spine, and our sacrum, right? So now, if those nerves also supply the muscles to our back, to our pelvis, right? So now, if those muscles are supplying all the things they're supplying, and things are kind of getting messed up in the process, everything else is going to get affected. Does that make sense?
Right. Yeah,
I'm trying to keep
definitely.
it without using like all anatomical terms. I'm trying to
Yeah.
just keep it basic in the sense of like, you can't do one thing and not affect the other thing. The
Right.
fascia's connected, the circulatory system's connected, the neurological, the nervous system is connected, all of it. So you have to kind of
Exactly.
unwrap the layers of the onion together,
Mhm.
really, like one by one, because it's all,
Yeah. Yeah, absolutely. And also kind of like what you were saying before as well, you notice a lot of the psychological effects that end up
oh, yeah,
happening. And I think a really common experience for people with endometriosis is they go through years of providers telling them that it's just psychological, that it's in their head
yes,
or it's anxiety or whatever. When
right,
a lot of times it's kind of the other way around, where the disease sort of caused all of these psychological systems over time. Because, right, like, so, like we were saying with the muscle guarding, like when you're constantly tense and tight physically, that's communicating through your
right.
nervous system, right? That
Yeah.
you're in danger.
Exactly, exactly. And to your point about stress, now, I'm also seeing patients with headaches, with this type of upper,
Yeah.
tensing, because now we're getting stressed out. We're like, what's wrong with me? Nobody's figuring it out. We're not sleeping right. I'm the idiot. I'm crazy. I'm this, I'm that. No, none of that. None of that. You're normal.
Mhm.
You're just not getting the proper treatment and diagnosis. But once you're doing all of this over time and you're not sleeping, then I'm feeling their muscles, their suboccipital muscles at the base of their skull, their upper traps, right? Those are holding trigger points. Again, I said trigger
Mhm.
points are the buildup of toxins in a muscle. They also, a key component of a trigger point is a referral pattern. So if you have a trigger point in your suboccipital muscle at the base of your skull, now it refers pain to behind the eye, up and around the head, right? So when I press back here, I'm like, do you feel that? And you're, yes, that's where I get all my headaches. If I press here, do you feel it? And there's these referral patterns. So now they're having their endo pain. Now they're having headaches. Now they're like, what? And they're being told that, they should see a psychiatrist perhaps. And I'm like, this is it's just years and years of, so you got to treat it all. You got to treat the neck. You got to treat
Mhm.
the low back. You got to
Mhm.
do, right. You have to understand the patient and really listen. I think that's the key. You have to really listen. You
Yes,
know,
definitely. I think that's kind of been a theme throughout this series is like we modern medicine is very reductionist, and while that's great, like we were saying when I was interviewing Dr. George, like we were saying, like if you're having a heart attack, you want a cardiologist there,
of
like it's
course,
life-saving. But
of
for
course.
something like endometriosis, your life's not in immediate danger,
Right.
and you need a more systems approach to
Yes.
truly get to, and it's so relatable what you're saying with it, like my upper traps,
Yeah.
particularly on the right side of my body, which once I got
Same
excision
side as your endo.
surgery, it's where all the
Yeah.
endometriosis is on the right side of my body.
Yeah.
It's
Yeah.
like, that makes a lot
No,
of
I
sense.
treated a patient yesterday, the same thing. She had all of her symptoms and everything was, and what happens is oftentimes if you have your symptoms from the endo on one side, you'll get the symptoms up here on the same side. And sometimes now your thoracic spine will get thrown into the mix. So on your opposite side, you'll get compensatory issues there. So
Mhm.
now it's like that, and you got to treat it
Mhm.
all. But again, what you were saying, although it's not like a heart attack and you have to have immediate care, you still have to be able to triage, like, how old were you when this started? What were your treatments previous to this? I mean, Nikki
Mhm.
was telling me about a patient who had gone through, hormonal seeding that, was causing her issues. And now, you question care sometimes. And I'm not questioning the physicians. That's not my wheelhouse. What I'm saying is people do what they know, and that's great. Nobody
Mhm.
knows everything. But sometimes, to your point, when you're doing what you're trained to do, you're not seeing the forest through the trees. You're treating what you're treating. And we
Yeah.
need that, but we have to be able to see the rest of it. Otherwise, the
Yes.
patient is left feeling like, okay, what about all the other stuff?
Right. And we also have to be able to check our bias because I
Yeah,
mean, when you are looking at the history of modern medicine, there's quite a few foundations there that are rooted in more misogynistic principles. And so when you
for
have
sure.
and when the data itself, like all
Yeah, no,
the
it's
high
true.
like yeah, like just when you collect all these things together, it really leads to training that is dismissive of women's pain.
Right.
And that in itself needs to, and that's a systems issue. That's not the fault of one individual person or provider. That is
Right.
just
Right.
the world
Well,
we've
it's
created.
just the history, I think, of education. I remember even in
Hmm.
chiropractic school when we were learning, diagnosis and treatment, we have to diagnose each condition and then we treat it. And just women's health in general was not, and granted, we're chiropractors and classically we're not treating women's health issues, but we still have to learn about, Lyme's disease and all of the other diseases that we're not
Hmm.
treating necessarily. So now I remember I said to Nikki, wow, I had no idea endometriosis was such an all encompassing disease. I learned about it in this little a paragraph like this. Some
Hmm.
women get this disease called endometriosis where scar tissue develops. Da, 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 da. I literally was given a book by Nikki and I read it in a week and my brain was just, what is going, why weren't we taught this? It's all
Hmm.
going on in the pelvis. It's the nerves of the lumbar spine. It's the nerves of the sacrum affecting these organs. Like, shouldn't we know about that? Well, like, I
Right.
guess, yeah.
Yeah. Yeah, especially with how
So,
prevalent it is. It's not a rare
yeah.
disease, not
No,
even
it's not.
remotely.
It's
Yeah.
not.
Yeah.
It's not.
It's
And patients, I think, are led to believe that, or led to believe that it's not so serious, like just cut it out and move on.
mhm.
But
Mhm.
just from the one book that I read, that Dr. Setchkin wrote, um, it's amazing that you can have these surgeries and they can excise the tissue and then it grows back. I never knew that. And it can
Yeah,
grow back. It can grow back in the intestines. It can grow back in the colon. So why do we
right.
have these GI issues? Well, maybe it decided to grow back there and now I'm constipated. I have endo belly. Whatever it
Mhm.
is, and then again, I can't speak to all of that. I don't know enough at this point about the specifics, but just from what I read, blew my mind. Yeah.
Exactly. Yeah, it really is just all encompassing. There's not, I think, when I was speaking with Jessica, she said something that like there's not like a cell that's untouched by endo, or she said something along those lines where I was like, that's so
Wow.
true.
Yeah.
Like,
Yeah.
yeah, it's so crazy. So like you were saying, it can grow back, like it can grow anywhere, which we
Hmm.
know, but more often than not, it is contained in the pelvis.
Right. Correct.
Not always, but a lot of times it is. So when you're working with patients, how do you begin to like address the adhesions and scar tissue that might be in the pelvis from the endometriosis?
Okay. So, again, I'm going back to the hip flexor because
Mhm.
it's like my favorite muscle right now because I'm finding, no, it really is an important muscle. But I never realized how important of an integral role it plays in endometriosis because I am finding that these patients have, whether it's the origin of the muscle on the lumbar spine or the insertion down like below the groin area, if you palpate the tissue there, you can definitively feel a difference in the muscle in women with endo and on the side, like I said, in the sides that are affected by it. You can feel, I can't say you can feel, it's hard to describe what a scar tissue feels like. The muscle just feels different to me. The fascia feels
Mhm.
different. And so then I address that by doing what I do specifically is a technique called active release technique. And what active release does in a broad sense is that you apply pressure to the muscle affected. You apply pressure to the point in the muscle that's affected. And then you take that muscle through a certain range of motion, the range of motion that it's supposed to perform. So for the hip flexor, I'll apply pressure and then I will extend the hip, which is to oppose the flexion, right?
Mhm.
Stripping out that adhesion. I'll do it in a cycle of usually 3 or 4 times. And I'll have the patient sometimes help me, sometimes they'll push against me. It just depends how acute they are and how much they can tolerate, because some of it is painful.
Mhm.
And once you take it through those 3 ranges, you'll see by the third range, it's able to go further. And if you do that several times and you repeat it, sometimes it doesn't take that long. Um, and you teach the patient how to do then at home stretches to address and continue the healing of that muscle. Because once you do it, you don't want to just stop. You want to do
Right.
it and then you want to have them go home and do stretches on that specific muscle. Over time, the scar tissue will break up, the adhesions will break up, the range of motion will increase, and the posture will improve.
Mhm.
It's a communication issue. It's about telling the patient and helping them understand. I try to show them a picture of the actual muscle. And yesterday I showed someone and she was like, oh, that makes sense. It's exactly where my pain is. I sometimes take for granted people know what the hip flexor looks like. Don't you know that? No, like you have to
Right.
explain it. And then all of a sudden it's sort of empowering because then they have sense of like why they're feeling this, why they're feeling pain in this area. I didn't know a muscle spanned that length. So,
Hmm.
not to go off on too much of a tangent, but to treat the scar tissue and adhesions, it really does take manual therapy to, and sometimes I'll use ultrasound, which is it's a physical therapy modality, but it's just sound waves and it increases blood flow to an area where there's tight muscles or where there's inflammation, and it'll also help decrease inflammation. Sometimes if a patient's really acute, I'll do
Hmm.
that first and then I'll just do gentle stretching. And then the next visit, I'll start with the active release. There's also a certain kind of stretch that you can do that the patient's involved in where they push against you. There's different, depending on the severity, there's different
Hmm.
ways to address it, but all in the goal of getting rid of the scar tissue.
Right. Yeah. And that's and being post op,
Yeah.
the scar, even the external scar tissue from the
Yes.
incisions is something that, like, there's just the one on my right side, it's always the right side, was just so angry from like
Yeah.
day one. And even like the massage of that and working with that with, well, with my PT has
Yeah.
been really, really helpful. And so I can
Yep.
imagine doing those types of things even for like the internal scar tissue
Yep.
would have,
Yeah. And
yeah. Mhm, go ahead.
PT is great too for that. A lot, I definitely implement a lot of physical therapy modalities into my treatment, because even if it's a superficial scar, you can do. There's another technique called Graston technique that I don't always, I wasn't certified in it, but I learned it some of it in school. So I just implement. I do some of it with my fingers. If you manipulate the tissue and you increase inflammation slightly, the body's triggered to then heal. If that makes sense. So when we have inflammation in our body, right? If it's stagnant inflammation and it's not inflamed enough, we'll heal to a certain point. But if you now induce a little bit more inflammation, then the inflammatory factors come in and can help it to heal a little bit more. So if you do that superficially, it'll help break up some of the scar tissue or decrease some of the pain at least.
Hmm.
All of that, all those manual therapies will help.
Yeah. That's really cool. I actually never really thought about like how or why it worked, but
Yeah.
that's super interesting. Cause yeah, we think of inflammation as like this bad, scary thing, and it can be in
Yeah, it
certain
feels bad.
circumstances. Right.
Right.
Yeah. But it's also how we heal, and we
Right.
would not have made it this far in evolution without.
Exactly. Well, that's the key. I mean, we really are, although we do need some help sometimes surgically or whatever, our bodies were made to heal us. So we
Hmm.
have it all inside of us,
Hmm.
and if we listen to what we need and we trust our bodies, it'll do what we need it to do. It may not always feel good, right? We're going to increase that inflammation. Sometimes it's like, I have inflammation, ice it. Oh my God, make the inflammation go away. Yes, you want to make the pain go away, but you don't want to stop it to the point where the body's not going to heal. So you have to
Right.
tolerate a little pain to get better.
Hmm.
So I saw
Hmm.
someone yesterday who I saw her for the second time, and I said, "Okay, now we're not going to be friends anymore because I'm going to start making you hurt a little." At first, I was like, "Okay, we'll calm this down," and
Yeah.
now she's like, she can tolerate more, so we're going to do a little
Yeah.
more because we want to get a little better. And
Hmm.
you endometriosis girls can tolerate a lot of pain. So my pain that I'm going to inflict, you can handle it.
Right. It's so true. Yeah, we
Yeah,
we definitely have learned how to cope with the pain
yeah,
over the years
yeah,
for
yeah,
sure.
yeah.
Um, I would love to touch on a little bit in our pre-chat. We talked a little bit about like comorbid conditions, like
Mhm.
hypermobile conditions that, yeah, often occur alongside endometriosis, and how, like we were saying, you practice chiropractic a little bit differently. A lot of people think of chiropractic as that like just traditional cracking, going to get cracked, or
Mhm.
whatever, but that's not always the best option for endometriosis and or hypermobile patients. Can you
Right.
unpack that a little bit more?
Well, yes, because I do, and I don't want to say that I don't think manipulation is good when necessary. I definitely manipulate some patients when I feel it's necessary after I've loosened up the muscles. However, when someone is hypermobile, you don't want to go into an area and now continue to mobilize it because over time, the ligaments protecting those bones that are now hypermobile are going to become more and more lax. And then the muscles around them aren't going to really do their job posturally. I'm just speaking from a postural standpoint, right? So if
Hmm.
you have a hypermobile lumbar spine, pelvis, and now you're doing a side posture adjustment, now those ligaments are already lax because of the hormones going on and things like that in women in general, and now you keep on moving and you keep on moving it's not going to do its job of protecting your posture, protecting your gait, holding you erect in a way that you're supposed to be. And now you're just confusing everything, right? So you want to kind of err on the side of conservative in my opinion, being more conservative with manipulation, especially on women who are acute with endometriosis. Over time, the opposite can happen if too much of scar tissue builds up and the muscles get too tight and things start getting locked up, then you're going to become hypomobile. So it's a fine balance between figuring out if the patient is hyper or hypo and then addressing it accordingly. So that's where the communication comes in. But if I have a patient who comes in and they're extremely hypermobile, there's no need to go in and start cracking everything around. People like to hear the cracks. They think something's happening, like, oh, I got cracked all over the place. If
Mhm.
it's necessary, great. If it makes, but it's really not where I go as a chiropractor because, and that sounds so intuitive as to what but there's a place for everything and you have to really be patient specific. So not everybody needs that. You just
Mhm.
and it's sort of an elusive answer to the question because I just really just talk to my patients and see what they need and feel
Mhm.
I can sort of just tell.
Yeah. Yeah.
And
After,
I'm
I
not always
mean,
right either. I mean, some people might say something different, but this is just what I think is,
mhm.
you know,
Yeah. Yeah. And after years of experience, I'm sure you pick up on patterns as well
right,
with certain people and what works better for those certain patterns, you know?
right. Yeah.
Um, so when it comes to the hip flexors, like you were
Mhm.
saying, because well, first of all, let me ask, could you be hypermobile in like one part of your body and then hypomobile in a different, or is it okay?
Oh, sure, sure.
Okay.
Yeah. I mean, some
Yeah.
people walk around, they're cracking their necks all the time, and they're always like, and I'm like, oh, don't do that. But
Yeah.
because I don't love when people do it, and it's not always great. But that's
Yeah.
hypermobility. When you're cracking your neck or cracking, that's hypermobility. You can be that way in your neck, and then all of a sudden, your hip flexors can be so tight, and you could have so much scar tissue. Your pelvis isn't moving the right way. Your posture that you're just stiff as a board in your lumbar spine and your pelvis and your sacrum and all of that.
Mhm.
Yeah, there's different regions of the spine. There's the cervical, which is the neck. There's the thoracic, which is the mid back. There's the lumbar, which is the low back, and the sacrum. And each section really has its own sort of identity, if you will. And
Mhm.
everybody's postural. Some people have anterior head carriage. The cervical spine, if you're looking sagittally, like from, the cervical spine curves this way. So it goes out, and then
Mm.
the thoracic spine goes back, and then the lumbar spine goes forward, so it kind of curves all like that. So each section can sort of do whatever it wants, depending upon
Mhm.
what's going on.
Gotcha. Gotcha.
If that makes sense, it's a little
Yeah.
hard to
No,
visualize when I do
definitely.
it that way.
No, definitely makes sense, and because I was just curious when you're talking about that, because I was like, I feel like I do get really, really tight in some areas of my body, but then in other, like, my hip flexors have always been very hypermobile.
When you're saying you were hypermobile in your hip flexors, explain do you mean your hips were like popping a lot in that way? What do you, because,
They do sometimes, but also I
okay.
can just kind of, like, open them quite a bit.
I'm just trying to figure out if you're saying the
Mhm.
joint or the muscle.
Just maybe the joint.
Maybe the
I'm
joint.
not sure.
Your hip flexor, most people I would say is not hypermobile because they're tighter, but the hip joint might be hypermobile.
Mm,
We're getting into semantics
yeah.
here that people are going to get bored with, but yes, I do understand what you're
Yeah.
saying that, each, on that right side where you have the endo going on, right? More so.
Mhm. Yeah.
That could
Yep.
definitely make sense. Yeah.
Well, let's talk a little bit about how the pelvis, how it affects the rest of the body, because you were saying before how it can really get into like the upper traps and the neck and all of
Yeah.
these things. Can you dive a little bit deeper into, I guess, just structurally, like how that makes sense?
It's more that I was speaking on a more broad term as far as endometriosis, right? So
Mhm.
I was speaking more about like a nervous system type of postural issue. So when you start having issues in your pelvis and your pelvis starts turning inward, or if even if you're just having pain and you're not sure what's going on, that's when I'm saying that we're starting to shift our posture. We're starting to hike our shoulder.
Mm.
It's like when you're stressed about something, right? What do? We all go like that.
Mhm.
Well, now you're stressed, you're ill, you're not feeling well. We're all tensing up. We're worried what's going on. That's when we put our secondary postural muscles into the equation. So I'm not saying that your neck is directly affected by what's going on here, but it is certainly, it's all affected by everything. So it may be one reason that's causing your neck to be a certain way and another reason that's causing your lumbar spine or your pelvis to be a certain way, but inevitably everything is tightening up. So
Mhm.
I believe that why I'm seeing more tension in the neck and the upper back of women with endo, I think that's more of the perhaps the emotional side of it,
Mm,
the stressful psychological side of it, that they're impacted, they're not being heard, they're scared, they're in pain. And so that's where that part I think comes in. But when you start carrying your pelvis more forward, your whole spine is going to change the way it's being held. That's just from an anatomical standpoint. So we just start to curve in. We start to form this. We start to go back to our fetus, right? When you
mhm,
think you're born this way, then you grow. And then as you get older, you go like this, right? Or as you get sick, as you're not well, as you're scared, right? So now everything kind of turns inward. So I see that and I can't say exactly why it is. All I know is that I see it and I try to ask questions about what the secondary symptoms are. You getting headaches? Are you having blurry vision? Are you not sleeping? Are you feeling dizzy? Things like that, because that can all happen because of the muscles in the cervical spine, the upper thoracic spine, and the trigger points again with the referral patterns.
mhm,
So, posturally, when one section of the spine is affected, every other it's a trickle down effect or a
mhm.
trickle up effect depending upon
Right.
how you look at it, right? So everything it's all, the spine just all works together in that way.
Yeah, well, and I feel like that's the theme throughout this
Yes,
episode is it's
it
all
is.
affecting everything. Yeah.
Yes.
Yes. So for people listening at home, who are maybe thinking like, okay, well, I have endometriosis. I never really thought of chiropractic for this. And also I think maybe more endometriosis specific chiropractors is fairly
Yeah.
niche as well.
Yeah.
Do you have any advice for people who maybe are looking to work with a provider or explore this path a little bit further?
Yeah. Well, first I'll say that I wasn't in my career as a chiropractor, I was never thinking endometriosis.
Right.
I really wasn't. But when like I said, when I met Nikki and I saw what she's doing, it just made so much sense because back to the theme, everything is connected. And one thing in chiropractic school, in all of everything we learned was connected. So when I say I practice differently, it's more that I just address the muscles and all of those things. And what I've learned through active release technique, through the different stretches that I do, through the different modalities that I use, is that if you don't address the muscles, then everything else is going to just go back because it's going to get pulled by them. That being said, if I could say one technique that if you're looking for someone out of this area, try to find somebody who does active release technique. It's ART. You can look online and find a practitioner. I don't get paid by them. I took, a few courses, but it has been the one thing that I have learned in my practice and in my career as a chiropractor that has made the most difference in all of my patients. I can say that without a doubt. And there was a chiropractor, his name was Jerlin Castro, who taught me in my course that I took. And he recently passed away, but he taught me the hip flexor ART approach, and any muscle in the body can be addressed with ART. So any symptom that you have in your body, you can address it with that. So that long-winded answer, once again, from me is that wherever you are, they're everywhere. They have seminars everywhere. They have chiropractors everywhere. They have physical therapists everywhere who can do it also. So that's something that you can start there, I think.
Yeah, that's great. That's because I think a lot of times when it comes to this, especially with like all of the different anatomical stuff and the nervous system, it's just the
Mhm.
lingo, that kind of stuff. So they're
Yeah.
like, I don't even know what I'm looking for here. So
Yeah.
that's
Yeah.
perfect. Active release
Yeah.
technique. And I'll also make sure to put that in the show notes for people.
Yeah. It's
Um,
great.
yeah, yeah, because that's really I think it comes back to just the language of, like, knowing
Mhm.
what to ask for, and when you're speaking with providers, and like we said, endo is tends to be very misunderstood, and so
Yeah.
finding a provider who's really willing to listen and learn something new
That's the
at the end
key.
of the day. Yeah.
And whether it's a chiropractor, a physical therapist, there it doesn't I don't think it matters what your title is as long as you know the anatomy, you're certified in what you're doing, and you look, you didn't just take a 24-hour course that I can do. You really have to be able to know and understand what you're doing with your hands.
Mhm,
So it's
mhm.
about listening to the patient and then responding accordingly. I think with
Yeah.
any profession, it's about listening to your patient, your client, your whoever. And, not pigeonholing people because
Yeah.
really every patient's different.
It's
That's
yeah, it's so true, and it's the same. I mean, I'm always, like, floored by how differently endometriosis can be in different bodies.
Mhm.
Even, like, and, as we know, the stage of endo doesn't really correlate with the level of pain because there's a
No.
lot of people with pain with stage 1 and really high pain, and then some people with stage 4 who actually have really low pain,
Yeah.
and it just, like, doesn't seem to have a lot of rhyme or reason in that sense, and then, like, the symptoms are on a huge spectrum, and it's like
Mhm.
those are always the where I get, like, the most comments from people of, like, "I had no idea this could even be a symptom of endometriosis."
Yeah.
It's like, yeah,
Yeah.
really
I'm
anything.
hearing that. Yeah.
Yeah.
I'm hearing that a lot too. And that is the most profound thing. It's amazing how there are so many symptoms. And I think that's why it's so hard for endo patients to feel like they've got it. I figured it out. We're going to treat this. Here's the treatment plan. I'm going to be good in 6 months because it's like a roller coaster. You figure it
Mhm.
out one way, you get treated, you get the surgery, it comes back in a different place, your symptoms change. So that's why and that's why I love Elysara because there are so many different practitioners who sort of you figure out, like Nikki listens to her patient and she's like, I think you need this, and then I think you need this, and then after that, because it changes. You don't always need the same thing. And you have
Mhm.
to back to saying, everyone is in a box, really, you have to get out of that if you're going to really
Yes.
help your patient. Because, I mean, I haven't been doing this work with Nikki for a long time. And in the short time that I've seen endo patients, they have all had a unique story, a different symptom pattern, and I can't treat them all the same,
Mhm.
and it's not gonna produce the right results for each person.
Yes,
So
exactly, yeah, there's no one size fits all
yeah, yeah.
solution for
Right.
endo. Wish there was, but it'd be
It
a
would be
lot
nice. It'd make it a
simpler.
lot easier, right?
Yeah. Yeah, but you're so right. It's not even just like with different patients, it presents very differently, but even like you were saying, like within patients, like
Oh, yeah.
as you go through different seasons of life and if you go through pregnancy that makes some really big
Mhm.
changes and if you get bad surgeries, which unfortunately a lot of endometriosis patients end up suffering through bad surgeries, and that can change the whole profile of the disease and how it's
Yeah.
showing up in your body. And so there's just so many. And then your level of stress, like obviously we just go through seasons where we're more stressed than others.
Stress is
And
huge. Yep.
like we were saying, it affects everything and that just all connected with the nervous system as well.
Yeah.
That
And
will
the stress of
just
having the disease or the stress of
yes.
life, and that's the thing with your musculoskeletal system. That is the first thing that's really, going to give you a sensation of pain because of the stress. You don't know that
Mhm.
it's directly related, but now are you carrying your stress in your neck, your low back? Is it because of stress? Is it because of the endo? Is it because of the hormones? You know what I
Right.
mean?
Right.
It's just so the best you can do is
Yeah.
listen, really. Just
Mhm.
listen, you know.
Exactly. Yes, and I always say track everything.
Yes.
Track your symptoms as well as you possibly can because
Yeah.
you'd be shocked at some of the insights that you realize.
Yep.
Things that were seemingly random, you start to notice patterns and it
Patterns. Yeah.
becomes a little easier to predict, a little easier to manage, I would say. But
Yeah.
I have one last question that I like to ask all of my guests at the
Sure.
end, since we're in health class here. If you could rewrite the health class curriculum that every woman deserves, what would your
Whoa.
first lesson be?
Listen to your body, listen to your gut, and don't listen to the voices around
Yeah.
you,
Yeah.
right?
Mhm.
And
That's
trust
amazing.
yourself. Trust yourself more than anything, because we
Yes.
all know what our bodies need. We don't like to listen all the time. But if you do,
Exactly. Yeah. Yeah,
yeah.
that's a wonderful message, and I think that so many endometriosis patients, if we had been taught that early in life, we probably would have gotten earlier diagnoses
Yeah.
because we wouldn't have been taking no for an answer. You're
Well,
kinda
it's
just
hard when you're
yeah.
young and when you're a young
Mhm.
lady and oftentimes the doctors are men and not men are wonderful, but they don't always get it. And you
Mhm.
listen to the people older and wiser and that's
Yes.
okay. That's okay.
Right, yeah. Yeah, we're not taught to ask questions, I guess, which is
Right.
always yeah,
Right.
like, you always wanna be asking questions, and like you say,
Yeah.
trust yourself. If you really feel like
Yeah.
something's wrong, that's not coming from
Yes.
nowhere.
Right. Right.
Mm.
Right. Don't listen to people saying, no, no, you're fine. It's okay. You're just a woman. No, you know when something's not right. Don't
Hmm.
quell that voice because it's going to come back if you don't listen to it now. It'll come back later and louder, I think. You know?
Exactly. Yes, it's so true. Yeah. No, it
Yeah,
absolutely will. You can only ignore it for so long before
right.
it manifests in a more serious way or more or less
100%.
less
Yeah.
ignorable way, I guess.
Exactly. Yes. Yes.
Yeah.
Very true.
Yeah.
Yes.
Awesome. Well, thank you so much, Dr. Katie. This has been
Thank
a
you.
phenomenal episode. I will make sure to
Thank you.
link all of your information. If anyone is listening from Huntington, New York, you can definitely go check out The Office. And then, like we said, for everybody else, you're looking for active release technique.
Yes.
So awesome. Great. Thank you so much, Dr. Katie. This was
Thank you.
phenomenal.
So nice meeting you. Thanks so much.
Yes, you too. Class dismissed.
Take care.